Well, hello, everyone. I'm glad you could join us tonight for this special webinar. We've got two guests that will be dealing with talking about how photobiomodulation can make a big difference on the brain and to do with brain injuries and dementia, PTSD, TBI. And we're actually a continuation from last week. So we will be continuing this week from where we left off last week. And also, we will because we know we've got a lot of content tonight, we may be going on to questions after 8 o'clock. So we'll basically say 8 o'clock is the time, but we will continue to allow people to ask questions, and we'll try and answer them by both our two special guests. So tonight we have Dr. Margaret Naeser and Anita Saltmarche, and Dr. Naeser has an incredible bio of the number of years that she has been involved in using light therapy. I'm just going to give you a brief summary here, because otherwise I'd have to write a book about all the stuff that she's been involved with. So so thankful that we got Dr. Naeser on tonight. So here's Margaret Naeser, PhD, is located in Boston VA Medical Center and is a research professor of neurology, Boston University, Chobanian, I guess, Avedish School of Medicine. Since 2010, she has studied the effect of near-infrared light-emitting diodes placed over the skull, the brain to treat brain injury, TBI and PTSD, dementia, stroke aphasia, and Gulf War illness. She has a strong interest in neuroplasticity and utilizing transcranial photobiomodulation to promote neuromodulation for brain recovery. This includes a resting state function connectivity, MRI, and magnetic resonance spectroscopy, MRS, pre and post a series of tPBM treatments. She has had VA NIH-funded research for over 40 years on the neuroanatomy of the stroke location in the brain, on CT MRI scans in persons with aphasia. She has published research using transcranial magnetic brain stimulation to improve language in chronic stroke aphasia. She has over 100 publications. She is on the editorial board photobiomodulation, photomedicine, and laser surgery, and fellow American Society for Laser and Medicine and Surgery. She has received her BA from Smith College and PhD from the University of Wisconsin-Madison. She has been a licensed acupuncturist in Massachusetts since 1986. She has conducted research with acupuncture and laser acupuncture to treat paralysis and stroke and pain in carpal tunnel syndrome. And so she's written a book, Laser Acupuncture, an introductory textbook for treatment of pain and paralysis, I'm going to have a tough one on that one, and other spasticity, there we go, and other disorders. Clinical research and users of laser acupuncture from around the world. Boston Chinese medicine, 1994 to 2024. And so this is a very special guest we have tonight, as well as Anita Saltmarche, and I will be introducing her a little later. So please get your questions, think about it, write down a bunch of stuff for the questions later on, and we will extend questions after the 8 o'clock period. So Margaret, would you like to join us, please? Okay, so Margaret's going to come on here with her video. We got your slideshow. Everything's looking good. All right. So I'm going to bow out at this point. Margaret, take it away.
Oh, thank you very much. Yes, so we're going to continue from last week. We were in the middle of looking at ex-football players with possible CTE. I'm going to go pretty fast if I can here because now I'm having trouble. Let's see. Oh, it's not advancing. Why don't is this advancing? I don't think I know how to make, there we go. Okay. So I wanted to share with you my co-investigators. They're all over Boston. They're really wonderful. Worked with many of them for 20 years. And we don't have any conflicts of interest to declare. V-Light from Toronto and Thor Photomedicine from London, UK have funded some of our research. So this is sort of part 3 and 4, but we will be picking up in the middle, sort of halfway through my talk from last week, working with the ex-football players who had possible CTE. I did want to review just a few things about basics that I hope you remember from last week, but if not, you can go back and look at the video or we'll get through this part fast. We work with red wavelengths, but they only have shallow 1 millimeter penetration. This is your whole visible spectrum here from 400 nanometers violet through up to red, 700 nanometers, and then beyond that, your eye can't see it anymore. But we also use near infrared nanometers, and they will go deeper because the higher the number over here, you can see on the right, this bar graph coming down, the deeper the penetration that we want to deliver photons. So we're going to mostly work with near infrared tonight. And remember from last week that cells that are low on oxygen, these little white bar, this white bar here is what we call hypoxic cell. Doesn't have very much oxygen, but then we're going to treat it with some near infrared light, 8-10 nanometers. And then after that, it's going to increase the amount of ATP, adenosine triphosphates, a battery pack for cellular respiration, by 6-fold. That's a big increase, whereas the normal cells only increased it by about 2-fold. And the normal cells just turn off their interest in the light when they have enough ATP. They just say they don't need it anymore. But when you have a low oxygen cell, the red light or near infrared is very welcome. We went over this last week that these are in this left-hand column here are the effects of applying the red and near infrared light. You will get increase in ATP, especially in low oxygen cells. We're going to promote vasodilation, do the nitric oxide release from the clogged up cytochrome C oxidase in the mitochondria. And that nitric oxide that's released will go outside the cell wall and promote increased blood flow, vasodilation of blood vessels, and also lymphatics vessels. That's very important to increase lymphatics drainage, get the waste products out of the brain. We will get serotonin. We don't have time to go into all that, but yes, they will have pain relief. There will be increase of serotonin. And brain-derived neurotrophic factor, which is extremely helpful for the cells to regenerate, for example, and recover. And also we're going to have antioxidant and anti-inflammatory effects. And we don't have time to go into all that, so we won't. But I did want to show you one movie from last week and showing you how a cell, this is a mouse fibroblast cell here on the left. And as soon as this laser light in the lower right-hand corner is turned on, the cell is going to swim around the obstacle and the cell is drawn right to the light. So I'll just start that and see how that goes. Okay, there it goes around this obstacle and drawn to the light. So the mitochondria can take in the photons from the laser and have better oxygenation, et cetera. So picking up on the football players, we did publish 4 cases in 2023, and they all met NIH criteria for chronic traumatic and possible CTE, chronic traumatic encephalopathy, the progressive neurodegenerative disease that all the football players are worried about getting, but they don't all get it. So that's another story. In any event, it's associated with repetitive head impacts. And you can see on the right here, these dark brown splotches are abnormal protein deposits in the brain that develop. They're called tau, hyperphosphorylated tau. And it's very, very serious disease. It starts out just in the frontal lobes here at the bottom left on the screen, but then that's only stage 1. And by the time it's stage 4, it's just progressed throughout the brain. So we would want to slow this down and improve quality of life as long as possible, because some of their problems are they have emotional outbursts, screaming, yelling a lot around the house. They have depression. Some commit suicide. And they have cognitive problems, memory, executive function, etc. So this is part of our protocol. All 4 cases of the football players came into our office at the Boston VA Medical Center, and they received, they were treated 3 times a week, 48 hours in between, Monday, Wednesday, Friday for 6 weeks, total of 18 treatments. And as we moved along, we got a helmet. We started out with just 2-inch diameter LED cluster heads held in place with a stocking cap. But we eventually got a nice helmet, and we could treat the midline and both sides of the head. That's just the front. So this was our first football player, if you remember this. He came into our study. He was 65 years old at the time, middle linebacker, defense position. And by the way, it's estimated that the football players throughout their careers, actually high school, college, and then also the pros, they have thousands of subconcussive hits to their heads throughout their career. So this gentleman's 65 years old. And now this is the way our graphs are set up. Now this is for PTSD, post-traumatic stress disorder. And you can see here the higher score is very bad and the lower score is much better, less post-PTSD. So pre-treatment, this football player scored 57. Now that is military grade PTSD. Civilians only have to score 37 to have PTSD. So he has a lot of problems. But he came in very cooperative, Monday, Wednesday, Friday, 6 weeks, 18 treatments, and then we stopped and we tested 1 week later. We never want to treat the same day after the treatment, test the same day after the treatment because it makes them sleepy sometimes. So here we are 1 week later. Oh, things are really good. Like we have a low score on the PTSD, and then we test again 1 month later. It's coming up a little bit, but everything's still good. His wife is happy, family's happy, everybody's happy. But then 2 months later, he really starts to lose it. This is a progressive neurodegenerative disease. Okay, so what's going to happen here then at 2 months, things are not going well. He's going to buy his own equipment and he's going to treat at home. And I'm going to explain to you this device that he got. And so we then, I just wanted to show you also, he also had cognitive improvement after the first series, but then that cognition for executive function started to go down. And then he treated at home, and then that came up higher than it ever was before. By treating at home, Monday, Wednesday, Friday, 6 weeks, just some parts of the brain, the default mode network. This was the whole head when we started out. And this test will come up several times, so I'll tell you what it is. It's called the color word interference test for executive function. And the words are written, so example, red is written R-E-D, but it's written in green ink sometimes. And sometimes the patient should read the word red, but sometimes should label and which should say what was the color of the ink, which was green. So that goes back and forth, and it's a pretty difficult test, and it is timed. So in any event, after he treated at home, then he got significant improvement from where he started. He got improvement of 2 standard deviations. So I want to explain what this device was that he used at home. And it was 2 months after his last in-office treatment that he had to start doing something again with photobiomodulation. So he started home treatments. And he used this device. And it's going to treat what we call the default mode network. It's labeled up here in the left corner. And it is an intrinsic network. And it has, for example, up here at the top, center of the forehead and high in the back of the head. You don't have to shave the head, by the way, to do this, but you should try to get those diodes on the scalp. So part the hair. So mesial prefrontal cortex and precuneus. All right, those are probably new words for you, but that's okay. They're just very important cortical nodes in the default mode network. Now, when you're sleeping, these nodes need to be in touch with each other. They need to be in good communication, and they will downregulate. Now, then you're going to sleep well and all that. And then also, when you're daydreaming, not thinking of anything, they are active and in good communication with each other. But when there's a lot of brain damage, and you see my arrow coming in here, moving along with my mouse, you're going to get a lot of brain damage right here in this mesial prefrontal cortex area. And that area is the most vulnerable, according to Rakel, very famous MRI or PET researcher. This is the most demanding part of the brain for glucose. Now look where it is. It's right in the center front forehead. And so no wonder it gets damaged in the football players. So in any event, these are two major nodes in the default mode network, very active when sleeping or daydreaming. And then we have some others on the left and right side of the head. And also we have to put a near infrared LED in the nose because we want to get to the hippocampus, which is the center very deep in the brain for memory. And we can't get there from here, as they say. So we have to send it up behind the eyebrow to the sense of smell, the olfactory bulbs. They're right here behind the eyebrow. And that's only one synapse away from the hippocampus. So that's how we try to treat the hippocampus, because that's part of the default mode network. Now, when the default mode network is dysregulated, not working well at all in so many disorders, a stroke, TBI, PTSD, they're all listed across the bottom here, depression, chronic pain, opioid addiction, Alzheimer's disease, aging, autism, Down syndrome, and on it goes, because this mesial prefrontal cortex is very fragile. We pulse the V-light neurogamma at 40 hertz because they did studies at MIT with Alzheimer's mice, and they found that if you blink the light, which was only shown in a dark room, to the eyes of the Alzheimer's disease mice, that will activate the microglia to actually collect the abnormal protein deposits. So they had a reduction of beta amyloid in the occipital cortex at the back of the head, because only the room light went through the eyes, but it did decrease that abnormal amyloid beta deposit by 60% and tau by 40%. Now tau, remember, that's the abnormal protein deposit that's present in the brain, and it gets more and more present in the brain with the football players that have CTE or possible CTE. So we always try to we want to remove these abnormal protein deposits. So, but remember, our football player kind of fell apart after 2 months of no more photons going into his default mode network or his brain. And that was actually similar to what Anita Saltmarche, and you'll hear from her tonight, observed with her dementia cases, probably Alzheimer's cases. She had 5 of them. And they were treated, here in the middle of the lower part, you can see the default mode network. This is a very prototypical early neuro device from V-light, and but they were treated twice a week for the first 2 weeks in her office in Toronto with this full default mode network setup, including the intranasal and the nose. And then they were only treated once a week. They came to visit her in her office. This whole series went on for 12 weeks. But at home, for every day they didn't come into the clinic, they put an extra, just one of the LEDs in the nose, near infrared, and it was pulsed at 10 hertz. So her results are shown here on the left. This is actually change scores on a test called mini mental state exam. And there are common questions, 30 questions, and what day of the week is it? What month is it? Things like that. And you can see that after 12 weeks of the active treatment, there was a significant improvement on that test, P less than 0.003. And then she took away all the equipment, no more treatments at home in the nose, no more V-light, no more treatments for the default network in her office, and everything fell apart. So again, we're working with progressive neurodegenerative disease in dementia cases. And the same results were seen over here in a different test the Alzheimer's Disease Assessment Scale for Cognition, and lower scores are better on that test. But you can see here on the right, after week 12, you take away the equipment and they start to fall apart. And that's what happens with our football players. Now, just to show you in contrast, the football player I showed you was not similar to mild TBI cases who were basically motor vehicle accidents, because those cases continue to improve. They don't have a progressive neurodegenerative disease. They were just in a car accident, which can be pretty bad. But this is their scores over time. This is the Stroop test, executive function, color word, and they as a group, their average score was below a full standard deviation below average. Average is 0 here, 50th percentile. Now Monday, Wednesday, Friday, 6 weeks treat. Take away the equipment, test 1 week later. Oh, they're almost as a group up to average. That's good. 1 month later, they continue to improve. And 2 months later, they're continuing to improve. You did not see that with the football players. Okay. Now, we finally want to get up here to neuroimaging, and I promised you we would, from last week. So what I'm going to show you in a minute is that although we treated the default mode network here in the middle, and you can see this is mesial prefrontal cortex, and of course, high parietal precuneus back here. We didn't get changes in the default mode network. We got changes in a different network, and it's called the salience network, and it's a network for attention. But I think that what we did when we put the LED cluster head on the forehead, we actually treated 2 different places. And you can see this red arrow here on the right, mesial prefrontal cortex for default mode network. And it's just in front of the corpus callosum here. We won't get into all this anatomy. But then because it's so close down on the lower sort of images I have here, that we also ended up treating the anterior cingulate gyrus, which is right here, this green. So you can see the green would be in here and the blue would be down here. And so I think you can sort of hit 2 networks with one, and you can use any LED cluster head you want. You could even use this one from the ones that Tom Kerber makes, his SunPowerLED cluster head. And I think that I'm sure you'd just get the same results. And you can see up here in the upper right-hand corner, we put our 2-inch diameter LED cluster head right at the top of the forehead where it meets the hairline. And we were treating 2 for the price of 1, mesial prefrontal cortex and anterior cingulate. I'm going to talk a lot about the anterior cingulate right here because that's the salience network where we saw all our changes. So very quickly, I'm taking you still with P1, our first football player, age 65. And all his changes are going to be in this salience network. Now, in the lower right-hand corner, I'm going to see, you can see, I want to show you what it's good for. The salience network is important for attention, whether it's internal attention, oh, I'm hungry, or external attention, oh, it's a sunny day. So whatever it is, it's internal and external. And it's like this so important network, salience network. It's like, now pay attention to this. That's why it's considered the attention network. And on the lower 2 graphs down here, you can see on this horizontal axis, the salience network average connectivity. So the greater the connectivity over time, and on this y-axis, this vertical axis down here, this is the Stroop ability to do that color word interference test. As that test gets better, the salience network average connectivity gets better, and the correlation is unbelievable. It's plus 0.9. And then you can see, remember up here in that left-hand corner, this is over time, the average connectivity for this salience network. And remember, when this football player came in, it was not great, but that's where he started. And then 1 week after all those treatments, 18 treatments, 3 times a week, 6 weeks, oh, his salience network got really good. But then it started to go down. And the connectivity wasn't so great, and his scores weren't good, and his PTSD was coming back. It was a very bad situation. But then he went home and he treated for 3 months, and then it all came back. So this correlation down here that's so significant in these bottom 2 correlation graphs show you that there really was a direct connection between the functional connectivity here in the lower right-hand corner for the salience network and the scores for executive function. And you'll see this with other patients too. Also, he had a negative correlation, the same patient, but his for PTSD, which again was highly significant, because with PTSD, post-traumatic stress disorder, you want lower scores, and then those are going to be correlated with the salience network average connectivity. So this is what you want to see. Second football player. Okay, he's 55 years old, and he's going to have the same pattern. Here's his PTSD scores. He comes in at 37 civilian PTSD grade, and he's good at 1 week after the 18th treatment, but then it starts to come up. So then he buys this device, the V-Light neurogamma, pulsed at 40 hertz, remove abnormal protein deposit, treats at home, 12 weeks, and then that goes back down. And then it was the same pattern for pain and his depression and things like that. But here is his correlation here on the central graph down at the bottom. Again, it's a Stroop trial 3 for executive function, and there's a correlation of 0.99 for the average connectivity within the salience network. So this is the connectivity, and this salience network is what really became important for their cognitive improvement, which was allowing them to pay attention. Now, very quickly, a different MRI imaging, we did something called magnetic resonance spectroscopy, MRS, and it's really just going to focus in on a metabolite. We chose the anterior cingulate to study because this seems like really important, especially for the football players. And you're going to see that. Now, I have to tell you what this NAA is that we're going to study. It's called N-acetyl aspartate. Don't worry about it. And it correlates. So you get a number that it correlates with the oxygen consumption in the mitochondria, but only of nerve cells. So only in the neurons in the brain, the gray matter or the white matter. And so these are the results for this football player for the anterior cingulate gyrus. I showed you where that was. And so pre-tPBM, his NAA levels are here. This is just where he started. But we want to know what's going to happen after we treat Monday, Wednesday, Friday, 6 weeks. And look, they go up. And that's this wonderful anterior cingulate gyrus, which is part of the salience network, which is really helping his cognition. And here he has less pain and less PTSD. And then 6 weeks after PBM was stopped, it's still up there. That's great. But then it goes back down after 12 weeks because he's on a progressive neurodegenerative disease. So that's too bad. I mean, it's just the way it is, but I think we can improve quality of life for much longer than they would otherwise have if they did not have photobiomodulation. And this is a third football player. He's 57. And again, it's the same story. Now, he starts out very high with PTSD. My goodness, almost 67. We treat with the helmet. He comes down 1 week later. And that's really good at 1 month. And then he said, oh, I'm not coming back. I'm just going to buy my own device, treat at home. I don't want to be tested anymore. So that was the end of that. But I'm showing you this graph because I want you to know he had a lot of pain when he came in. Here's the short form McGill pain questionnaire on the lower left. And you can see his pain scores went way down. And he was able to stop 2 of his narcotics medications he had been on for several years. He had a lot of pain in his left shoulder because he had 15 surgeries as a football player on his left shoulder. That was really something. So he only stayed on the gabapentin, no more narcotics. So he also had a great reduction in his tinnitus, the ringing in the ears, and that's was also observed in a study done in Japan. On the upper right-hand photograph here, you can see on both sides of the neck they applied some near-infrared LEDs, and you can see that in our helmet, it turns out that the helmet is delivering red and near-infrared. You can't see the near-infrared, but to the sides of the neck. You have to treat the stellate ganglion. And I think that this would be a wonderful treatment for our diplomats who are suffering from Havana syndrome. And I don't know if they have access to this or not. Last football player, and he has a significant correlation with his pain score and the increase in the salience network functional connectivity. So, and there are pain-related neurons also in this anterior cingulate here in this cortex, and I'm sure we're delivering photons there as well from outside the forehead. So we had significant reduction in PTSD, depression, pain, and that improvement in sleep, significant improvement in sleep. What's important about these, the work that we're doing here, we are draining, we are vasodilating the lymphatic vessels. That's here on the left. You can see from the side what they look like. And we're going to deliver photons to dilate the blood vessels here on the right side. And these are very much in close proximity to each other to remove the abnormal protein deposits. We want to get them out of the brain. They're even interfering with sleep. You have to get them out. And they will eventually drain down through the jugular vein. So you'll be able to get it out of the brain. This is what happens when you fall asleep. Right away, you should have cerebral spinal fluid, which is dyed green here. It's not green. But anyway, it comes in and it starts massaging the vessels to get rid of these protein deposits. And in fact, the first complaint from almost anyone with a, dementia, Alzheimer's disease, or the football players, they say, I can't sleep. I cannot sleep. Well, they can't sleep. And so we have to get rid of, they've got too many protein deposits in there. Tau in the football players, beta amyloid and tau in Alzheimer's disease. So many people are now suggesting when you do your photobiomodulation, do it at night, just before you go to bed, because you want to vasodilate that. And very quickly, this is Anita Saltmarche's study. She had 5 cases, and I wanted to point out their age at entry. They are from age 72 to 90, and she's going to get significant results in all 5 of them. And this is a mini mental state exam here. It's, again, I mentioned it before, there's 30 questions, what day of the week, what month, and so on. And these are the moderate severe ones. They could only get 10 out of 30 correct. And the others are 21, 22, and 24 correct answers. She treated the default mode network, as I said, in her office twice a week for 2 weeks, and then only once a week for the next 10 weeks. But every day they didn't come in the office, they used a separate intranasal LED, 810 nanometer, to get up to the olfactory bulbs and then ultimately to the hippocampus. So I showed you this before, and as soon as you take the equipment away, they plummet. And it was the same thing for the Alzheimer's disease assessment scale. And she has nice anecdotal information she'll talk to you. She will talk to you about that later. And this is one of the patients I just think is fantastic. When she came into the study, she could not cook. She had decreased ability to cook, wasn't interested. After 12 weeks, she came in able to give a recipe to the assessor by memory. And then, but after they took the equipment away, she cooked and cleaned less and less. They just need the continued treatments, and that's how they can cope with their depression. With their Alzheimer's disease. And this is a second study with similar results. Linda Chow in San Francisco, she's going to treat with this V-Light for the the default mode network. And here on the left, you can see the blue is the photobiomodulation group, and lower scores on this Alzheimer's disease assessment scale is better. It's highly significant reduction. And this is the neuropsychiatric inventory. And this is also highly significant. UC is usual care. They didn't do anything, no treatment. Maybe they were taking Donepezil or some other medication, but they just continued to get worse. And she did find increased functional connectivity in the posterior parts of the default mode network after that treatment. And then some of them who, 3 of the cases in the usual care group that really weren't getting the treatment were switched over after the 12 weeks. And you can see as a group, they went down. This is great that their ADAS-Cog lower scores are better. And then somewhat on the neuropsychiatric inventory, I don't know what happened there, but they did better, and they were grateful to have that. So the last slide, increase in ATP, blood vessel dilation, lymphatic vessel dilation, salience network, very important. You remember that anterior cingulate gyrus. And the NAA, the N-acetyl aspartate in anterior cingulate was present and increased at week 1 and week 6. This is very important for their cognition and reducing PTSD, and increased brain-derived neurotrophic factors, serotonin, melatonin, with improved sleep and reduced inflammation. So, so I don't know how you want to do it. If you want to start Anita or you want to do your infomercial, just let me know. I'll stop sharing my screen.
Oh, yeah. Okay, we're just going to go into the infomercial on our product line here. Thank you so much, Dr. Naeser, for absolutely a wealth of information, how this can help people. And I'm sure we're going to have a lot of good questions coming up. So thank you so much for sharing. And so now I'm going to go into my commercial here on our products. So we have several of the Palm devices. This particular Palm here is the professional, and it has the 2 wavelengths, which is the 660 nanometer, and you can see how that's going right through my hand. And then I have the 810 nanometer. This one here, you can barely see. We have then the Ultimate, which has 25% more power than that one. And then we have the Super Palm 1050, which still has the 660 nanometer wavelength, same as what I showed you there. Still 25% more powerful than the original professional. But then we have 1050 nanometer. And 1050 nanometer, if I look at it, it's totally invisible. And but you can see it in the camera there, a little bit of purplish dots. We put this little red indicator in there just to show people that it was working. So those devices can be used on the brain and different places. We've had people with seizures improve, migraines. Just go back into our past videos and you can look up seizures, you can look up migraines, you can look up all different kinds of ailments, concussions, and as was discussed by Dr. Naeser as well. No, sorry, I'll do this one first. So this is our mini canopy. This device has 15 times the area of the Palm devices, but still the same power density, which is really, really important. So if you look at this, that's the 660 nanometer. Now the 810 nanometer, it doesn't, with this light showing, it's more of an invisible wavelength, so it's hard to see, but it is there. You can see a little bit of purplish dots there, but that wavelength, as Dr. Naeser has pointed out, actually penetrates even deeper than the 810 nanometer that we have. So the 660, 810, and we've also developed a helmet. So this thing can go on a person's head and lower down, set it to the right height. And it has the 2 wavelengths as well. Inside, you feel a nice warmth. If I turn it to the 810, you can see the purplish lights in there, showing you that the 810 is being used. And this is the one that we've already been able to see with concussions, strokes, and we believe that we will be able to make a major impact on TBI, traumatic brain injury, as been talked about in this event so far, and also PTSD. We are also having if anybody wants to go to Rays of Hope for Israel, that's raysofhopeforisrael.com. We do have a donation page where people can donate. We're sending equipment over there to be able to be used by the hospital. We're just waiting for final clearance, but we have some equipment there ready that can help with people with PTSD, TBI. We can look at major burns. And this is not just for the soldiers. This is civilians. This is Palestinians. Whoever comes into the hospital will be treated. And it's the largest hospital in Israel that we're looking to work with closely with many of our devices, including the mini canopy, and soon we hope as well the helmet. So anyways, we appreciate you coming on tonight. And now we've got our second special guest, Anita Saltmarche, and she will be explaining more about PBM. And I would love to give the introduction as to how much knowledge she has gained on using light therapy on the brain. And unfortunately, I can't find it right now. Sorry about that, Anita. But you're definitely our welcome guest. Thank you so much for joining us. Okay, I think I'm going to disappear, and you're going to be gone.
Okay, and that's not a problem. Thank you. My name's Anita Saltmarche, and I was a geriatric clinical nurse specialist at Sunnybrook for a number of years. And then I've been involved with laser and light therapy called photobiomodulation for about the last 23 years. Dr. Naeser and I have worked fairly closely over, it's hard to believe, Marnie, 20 years now. And yes, it's been an ongoing, wonderful learning process along the way. So Dr. Naeser gave you an overview of some of the work we were doing in dementia. And let me just tell you about the lived experience and what it was like for the families and individuals who were involved in the study. And so these individuals lived at home, and so their wives most often, but also other family members brought them in for treatment in the clinic. And I'm going to tell you about a few of the participants. And Dr. Naeser talked to you about our first participant. And she was a Portuguese woman, spoke predominantly Portuguese at home, but was able to do a little bit of communication in English, but mostly her daughter actually translated during that first session and assessment. She was quite apprehensive, was not engaged. She would answer questions, but with, reservation. And her English was not that great. She started her treatment, and as Dr. Naeser mentioned, she had treatment twice a week in the clinic and then once a week after that. But they did daily intranasal treatments on an ongoing basis. At the end of the 12 weeks, this really was, and she knew it was the end of treatment. And we had talked about, while she was being treated, some of her dishes that she used to cook. And she came in, and I was so surprised. She, during the session, told me how to cook this recipe from memory, and she had barely spoken, and it was all in English, and it was really quite remarkable. She was bright. I mean, prior to this, she kind of just sat there. She often complained that her head was too heavy and had a headache. She was now much more communicative with not only myself, but her family on an ongoing basis. And as Dr. Naeser had mentioned, she had lost all interest in housekeeping and cooking, which for her was a really meaningful part and participation with living with her family. And so that changed after the treatment. And it was really wonderful to see. She was back taking walks with her family outside. And then at the end of the 12 weeks, part of the understanding of the study was those devices would all be taken away. So there was no intranasal and no treatment in the clinic. And slowly she became more withdrawn, less engaged. She really stopped cooking, taking any interest in that, or cleaning. She withdrew. She really didn't talk to the family and communicate. And so at the end of the study, they were actually given their devices, and she improved again. So sort of an indication of how important that light therapy was. We had another gentleman who in fact wouldn't even make eye contact with me. English was not his first language, Italian was. And we have a very multicultural city, which is wonderful. And very long pauses in between questions. So he's having a hard time kind of processing the questions and sort of coming up with the answers. And very stooped over and kind of shuffling in, lived with the caregiver, not the family, but an individual who was his caregiver. And his wife had recently died. And it was quite distressing for the family because they really couldn't talk about the mother. It was like he just didn't remember. It was really tough. And at the end of 12 weeks, he was speaking and communicating with his family. He was pretty dependent on his caregiver. He was not able to go in and pick out his clothes and dress himself. She really helped with that. And so at the end of 12 weeks, they had sort of a monitor in the bedroom just to make sure that if she were in the kitchen cooking or doing something else, that if he were there on his own, he was still safe. And to her surprise, he got up after coffee and then talking over breakfast, went into the bedroom, picked out his clothes, got his clothes on, And I know this doesn't sound like a big deal to us because we do this sort of thing day in and day out. But to the family, this was really quite remarkable. He was initiating, he was initiating conversation and participating. He was an active participant in the family. And it was like having their dad back again. Again, we had to take the equipment away at the end of the 12 weeks. And in the first week of treatment, he had a rapid decline and became belligerent, uncooperative. He started the stoop, walk again, and his walk had really improved. He'd walked in without a walker, just hanging onto his son, his arm, and much more upright posture. Again, the stoop starting, wasn't interested in his hygiene or dressing. So this was really a big change for the family. And again, he started back and he did improve. So again, that's sort of showing how different these individuals can be when they actually have the treatment. And this goes on and on. I mean, we had a number of individuals, their sense of humor came back. They were able to communicate. One of the individuals who was a wanderer, and that can often be something that is quite distressing and in fact can be unsafe and very difficult on a caregiver because he was up wandering at night and one night actually wandered outside in the middle of the winter. So these sorts of things can be very problematic. His behavior changed dramatically. He was able to start playing cards with them again. Again, that communication. And when you're caring for someone, that's really important. The ability to not only be able to communicate with them, but they can reciprocate in that communication. And the thing that really surprised him, one day they were sitting out on the porch and he noticed the screen door was squeaking and he got up. He was able to assess the situation on his own. He had not done this in months, if not a year or two. He went to the toolbox, got the tools he needed, came back out, fixed the door, sat down like nothing. And they were all just sort of going, this is amazing. We can't, ever recall him doing this in the last year or so. So these are the functional day-to-day changes that can occur, as Dr. Naeser has mentioned. Sleep improvement, which means not only the individual with the Alzheimer's, but the caregiver can now sleep again. That's a very big issue. Behavior can become an issue, especially with sundowning after after the sun goes down. Often they become belligerent and don't want to cooperate with things. And so behavior can be quite changed. So many of these things with light therapy can improve. And Dr. Naeser talked to you about the memory and the other tool she was referring to, the Alzheimer's Disease Assessment Scale, gives you an indication of functional level, the day-to-day functioning of the individual, and that improves significantly. And I think what's worth mentioning is these individuals, and we've just finished a Parkinson's study as well, do not experience any significant negative consequence of treatment. So I think that's important. First and foremost, this is safe, and then it's effective. It often does not happen. I mean, Tom does have some pretty amazing stories, and he's going to share one with you, I think, about a young child with traumatic brain injury. But in the older population and in something that's fairly chronic, these changes take time. So we can be looking at 8 to 12 weeks. Sometimes with Parkinson's, we're probably looking at even longer time frame, but that these changes do occur and they can be incredibly meaningful. So I think the upshot of this, or the lesson learned, is that this is a technology that's safe, that is relatively inexpensive, and in fact, I think we've talked about it, probably in 76, 78% of most cases is successful and we see meaningful change. So I'm going to leave it at that. I'm certainly open to any questions, and I'm sure Tom has many of them there. but it really is a wonderful technology. And I'll turn it back to you, Tom. Thank you.
Okay. All right. Well, Anita, thank you so much for coming on. And you're going to have to stick around a little longer for answering
Yes.
all these questions that are going to come up. But Anita, that was absolutely wonderful to hear of those testimonies of what can happen in part of this research, just to see the difference in people's lives. I mean, if they can go outside and get a toolkit and start fixing things, well, you know, the house can be a whole lot better place to live in, right? If the doors don't fall off. So that's remarkable. And the big thing here is a lot of times, depending on the condition, a person may need to continue those treatments for the rest of their life, to continue on. So right now, what I like to do is play a video of a young man with a concussion, a young boy, 12 years old. And he had been playing a game and amongst all his friends in the church basement and hit his head really bad. And you can hear about it. Thankfully, he didn't have brain bleed, but he had a bad concussion. And anyways, you'll be able to hear how this light affected it. Now, he's still not 100% at this video. That was only after the second treatment. We got the feedback then of what happened, and that was only 2 days after the original treatment. So let's go ahead and play that video of Tyson. That's it. Hi, Rose.
Hi.
Tyson.
Hello.
So, Tyson, what happened?
Well, I went to like a cadet group, so it's like kind of like you learn skills and stuff. And I fell and hit my head. I got a really bad concussion, so I couldn't really do anything. I couldn't read. If I stood up for too long, I'd get a really bad headache. And we were trying different things like oils and stuff like that. And then my mom's friend recommended this, the red light therapy.
Yeah.
And so we went over here and we tried it, and straight away I felt results after it was done. My headache cleared up like quite a bit, and that day I was able to pick up a book and read, when before I couldn't even read a sentence. I'd get a really bad
when
headache.
did this happen?
Happened I think last week Friday.
Okay, last week.
It was Thursday that
Thursday, last
so it was a
week,
week
Thursday.
ago.
Yep.
A week ago, Thursday.
Yeah,
And
he had like severe memory loss. He still doesn't remember that day at all.
Right.
So I don't know if he'll gain that memory back. But we took him to Mac, and they did a CT scan and that, because he was continuously asking the same questions, like, what happened? Why does my head hurt? And like, it was on a reel, like probably every couple of minutes we tell him what happened. He's like, oh, that would be why my head hurts. I don't remember going to cadets.
Yeah.
And then he would ask it all over again, like, how come my head hurts? So like he probably did it hundreds of times. So they did a CT scan and they didn't see anything on the CT
That's at
scan.
McMaster University.
Yeah, at McMaster.
Yeah, yeah.
And then he's got to follow up with a neurologist in a few weeks because it was that bad. But
Right.
he's
Did you
like-
have any double vision?
No, not that I remember of that day.
But you couldn't read a book and
No.
you couldn't watch a video or
No, he had to be in a
I
dark
could,
room.
I had to really lie down. If I stood up and tried to move around, I'd get a bad headache. I tried reading a book. I got, I think, a sentence, and then I got a split and a headache again. So.
Okay.
Because he really likes reading, so he was hoping to, because he was bored. He gets bored because he was lying around in a dark room listening to audiobooks. But yeah, the minute he started reading it, just
Okay. And so you did a light treatment under the helmet,
Yeah.
and that was 1 minute of the bright red and 3 minutes.
of like the one you can't see.
Right, that's the near infrared.
Yeah.
And so 1 minute and 3 minutes, so 4 minutes of treatment.
And it was amazing. Like after the 4 minutes, I could tell straight away my headache was gone. I just overall felt better.
yeah. So you were still tired and stuff. You
Yeah.
didn't read yesterday yet, did you?
No, I didn't read yesterday.
Oh, you didn't read on the day you got the red light
Yeah.
therapy. Yesterday you started reading.
Yeah, I tried it, and I'm like, hey, I can easily read. I don't get a headache at all.
Well, we
And-
could tell a difference because he was really subdued. Like he's been really, like just hanging out in his room, really quiet and not.
Right.
And now he's like, whoop, So like,
That is
he's
excellent.
definitely back in that sense.
And we're going to do just one more final treatment
I'm
here,
gonna do another
probably.
one, yeah, because
And just to make sure that things are covered. But
yeah.
well, thank you very much for being on our video,
Yeah.
Tyson, and really neat how we were able to see this. This is going to tell a lot of people what light therapy can do.
Oh, he's very grateful. Yeah, we were very, very blessed and pleased that we found this.
Yeah.
Yeah.
Okay, all the best. Bye for now.
Thank
Yeah.
you.
Tom, while you're doing that, should we start with some of these questions?
It's fine.
Uh, okay, Marnie, I'm just going to read some of these out to you. Are you okay with that?
I saw them also.
Oh, you saw them?
I
Okay.
saw them.
Okay,
Yeah, I was
great.
looking at them. And so, one of them wanted to know, has anybody done it? The first one, I'm just going in the order they came in. I guess the baby had a traumatic brain injury shortly after birth, newborn, and 5 and 10 years later, I gather there's still some hypoxia in the brain due to that damage. I don't have any experience with that. I don't know. Anita might. I would try it. I really,
Yeah.
and keep at it. It can take 6 months to see change because you are trying to get whatever neurons are left there in the brain to work again. I mean, you can use almost any device. I mean, you can use the handheld device from a SunPowerLED. You can use V-Light, the default mode network. You can use a variety of others, but these are the ones that we have more experience with. And so I would go for it.
And I have also had experience with that, Dr. Naeser, and I think we have seen very good results. I mean, I've had infants who have had seizures from hypoxia and developmental issues, and there are things that can be done. As you say, it takes time, but these are young brains, and it's definitely worth a try.
Well, this is
and
5
I'm
or
happy
10.
to work with them.
I think this child is now 10 or 15, but that's okay. I still wouldn't give up on that at all. I mean, I would try it. It's not going to make any harm. That's the most important thing to understand. It's really not. And I've seen a very young child too. The father fell down the stairs with a 3-month-old baby and was treated with the LEDs by Diane Giuliano, a licensed acupuncturist here in the Boston area, doing transcranial and also laser acupuncture near infrared light on points on the body. Really, with a baby, you only need 5 milliwatt red beam laser lecture pointer on the acupuncture points. And when they took the baby back, I guess 6 months, to the neurosurgeon because it was so severe, they had to put stents in the ventricles, ventriculoperitoneal, and for draining. And the neurosurgeon said he would never, if he had not seen that baby at 3 months in the acute state. And had to do neurosurgery at that time. Seeing the baby at 6 months, it was just as if nothing happened. And I think I would guess that a lot of it came from the photons, the red and infrared applied to the scalp and the brain, as well as on the body, on the acupuncture points. And this baby had already undergone a lot of physical therapy at the local hospital, but the physical therapy didn't help that much, as far as the mother said. And the big changes were when Diane started treating the baby with the really the red beam laser lecture pointer, just 5 milliwatts, because it's easy to treat babies when they're that young. Okay, the next.
And then,
in case of football players, what was the length of time per treatment? It was about a half hour. It wasn't very long, 20 minutes to a half hour. The home treatment has a shut off if they do the V-Light neurogamma. That's going to shut off automatically after 20 minutes. So the home treatments were even shorter. Let's see. Oh,
and what's the difference between V-Light and Sunbeam or SunPower? Sorry,
SunPower lights. I don't get into the specs that much. I think the SunPower has larger light emitting diode array. It's 3-inch diameter. And you do have to hold it with one hand on whatever part of the brain you want to put it on for a traumatic brain injury, et cetera, which will be both sides and then down the middle and at the back and so on. So each one is 4 minutes. Red is 1 minute, 3 minutes, near infrared, but with the V-Line Neurogamma or their latest device, they don't really make that one anymore. They have some other ones. You just put it on like earphones or something and it sort of sits on your head. 20 minutes is the treatment. So it just depends how many places on the brain you want to treat. But with the helmet that SunPowerLED has, that's 4 minutes. That's the whole head in 4 minutes. And you get to see this little boy here, 12 years old, how much he improved after one treatment. And then he came back and videotaped. I actually was able to speak with him the day that happened because everyone was so shocked what the
yeah, the amount of improvement that boy had. And I'm so sorry to everyone here that we weren't able to play it, but we will try it in a bit. It's going to go? No. Okay. All right. Well, let's continue on with the questions then. But yeah, the different models, different, but PBM, the big thing here is PBM can make a huge difference in brain health, and as we've been able to see. Continue on with the questions here. You're doing great.
Okay, I can't get any video myself on my end here. I don't know what I have to do, but
Okay.
I can audio. I have. It doesn't really matter. I don't think I have to show anything of my.
Yeah, I'm not sure you're.
There, I started.
There you are.
Okay, then just in
Okay.
case I want to show anything that I have, any of my props here. I have a brain that we could look at if you want to look at the brain, and I can show you where some of these parts are that we work with. It's a 20 to 30 minute treatment. So what's the next one? Oh, is this scary?
Car accident. Yeah.
Car accident, occipital lobe. It doesn't really matter. You really want to put the LED cluster head, whichever one you're working with, in with a focal lesion, and you're talking focal spot lesion here, and you want to treat that area with whatever device you're going to use, and this is fine, the Ultimate, the Palm Ultimate, or this is what's important, and we're going to get into this next week. When you have a stroke, for example, on the left side of the head, and that's your dominant hemisphere for language, you're going to usually have language problems, aphasia and whatnot, but only treat that side of the head, at least in my experience. Don't treat both sides of the head, just treat where the damage is, and don't treat down the middle, especially not at the top, because you're going to end up getting it on both sides of this supplementary motor area. We'll talk about that next week. And you're going to get activation on both sides of that supplementary motor area, and that's where someone has activation if they stutter. So we don't want to make our aphasia patients worse. We just want to help the left side of the head. So with this person, your wife, we need to know where there is the lesion. I'm sure it's somewhere in the brain. It's very specific because of her significant visual issues.
Occipital lobe. Yeah.
Well, is it left or is it right? That's our question. If it's left occipital lobe, put it on the left occipital lobe. If it's right, put it on the right. If it's both, then that'll be fine. So when it gets to focal specific spot lesions, we're more careful. But traumatic brain injuries, usually both sides of the head, Alzheimer's disease, dementia, both sides of the head, football players, possible CTE, both sides of the head. You can't go wrong with that.
Yeah. I just take a little moment here. We're going to continue with the questions, but I just want to mention a few things. So for all those that hung into this part of the broadcast, we're going to say that you have already been entered into the draw. That once a month we give away one of these super palms, $1,900 value for listening in and telling your friends to come and listen in. Next week, I just want to make sure we got this in there, but we're going to continue with the questions in a minute here. Next week, we're going to have Dr. Naeser and Anita Saltmarche both come back on, and that'll be a fantastic event. The only thing, I will be up in the sky. No, I'm flying is what's happening. Okay. I don't plan to leave this world yet. So I'm going to be flying, but I have Sam that's going to be filling in the shoes here. He's doing an excellent job of running things. Just today was just a little glitch on the audio. That happens sometimes. But please make sure you join us next week as we will continue this, I'll call it a saga on information on the brain, because this is fantastic information that you have been able to derive from the past quite a number of years of work, in this field. So please definitely tell everyone to join us for next week. And so let's go back to the questions here. And thank you everyone for joining us. Let's go to the questions.
I think we left off, I think I answered the anonymous attendee one who wanted to know if you can do harm if you put it in the wrong part of the brain. And the only time it seems to be a problem is if it was a stroke. So we went through that. And we'll be talking about that more next week. Okay, now Anita might be able to answer this one too for Beth. And a totally different subject. Any research on helping stage 4 kidney disease? Now that's a really good question. I want to say something about animals first. There's a wonderful veterinarian here in the Boston area, Ron Hirschberg, and he treats kidney disease in dogs. And he uses a laser cluster head. He has to get through the fur and all that, I guess. And he puts it right over the kidneys. And he can rescue these dogs because it does improve the circulation for the kidneys. So I just want to mention that. Anita, you might have more information on that. And I know it's been a question that's been asked at various times. And I knew there was a VA medical center in the Bronx that was interested in doing it. But I don't know if they ever got that project off the ground.
Okay, and I'll just mention one thing here that for that video that I couldn't play, it'll be up on our website, I think tomorrow, Tyson, and it'll be labeled Tyson and Concussion. We'll make sure that's up, and we also have a copy of last week's video as well, webinar. So it's up already. But let's continue here. For those that want to hang in and learn more, this is great. So fantastic. Go ahead.
Anita, do you have any comment on treating kidney disease?
I think it would definitely be worth it. It's not going to do any harm. And, at stage 4 kidney disease, you could be looking at, that's right, exactly. The palm would have, I would certainly go with the probably the 1050, because you'll get that depth of penetration. And yes, I think you could treat directly over that. I mean, you can get the palm from Tom, and I'm happy to work with individuals. I mean, my practice is virtual, and I'd say half is in the US and definitely Europe and Australia. So I don't see that many Canadians actually. So yeah, definitely
Also,
worthwhile.
I did want to mention one thing. I mean, kidney disease is very difficult. I had a friend who had a traumatic brain injury. Well, actually, she fainted and ended up having parasites and had the spleen removed. It was really awful. And her kidneys took a big hit on that. And I actually did send her some LED cluster heads that Anita had also used in the past for us with TBI at the VA hospital. But I sent Chinese herbs, and I think most Americans and Canadians have no idea to go find a Chinese herbalist, because I'm also licensed to use Chinese.
That's a great idea.
25 years, and it helped her so much. Her creatinine clearance, I mean, it was really bad. It was like 1.5. It was way too high, and it got down to 1.1, and it was the best in her life ever. And so just think about that. It's very compatible with acupuncture and Chinese herbs and with lasers and LEDs, and there's going to be no harm. I never had anybody have problems. Just want to mention that because kidney disease is difficult.
Great idea.
Okay, so next question here.
Let's see, Gary, we took care of that. Oh yeah, we took care of that occipital damage. Rosemary, could you tell me which machine was used on those 2 patients? Which 2? And how long treatment? How long
Maybe
each?
those are your 2 football players, Martin? Or
I have 4 football players, so I don't.
Right.
advantage too. But well, I think that maybe what I'll do is send my published paper with the football players, and maybe Tom Kerber can post that on
We'll
their
put it
website.
in, we'll put it
Mhm.
onto, if a person goes into the resources or more, and then look up resources, in the resources area, there's PBM findings, and you can find PBM findings, resources. You'll find the posted information. We'll put it there.
Okay, so they can get access to it.
Yeah.
It's been about a year, so it should be free access anyway.
Thank you, Barb, for sending the question.
And Barb says, what is the typical duration of the long-term daily or multi-times weekly transcranial home treatments? Well, it's usually Monday. We always start low and go slow. That's Anita's motto here. And if we say to start maybe at half dose, make sure you're going to be compatible. It'll be compatible with you. And then Monday, Wednesday, Friday, and then work up to full dose, which would be whatever the manufacturer is recommending as what is quote their full dose, because it depends on equipment and what you're treating.
Yeah, I'll just mention something about the equipment there. And I know you're learning more and more about our light, Anita, but I have seen really deep results with even the ultimate or even the professional. So it doesn't have to be the Super Palm, but that is our top of the line unit for pushing the depth of the deepest. But I can't tell you how many people have been helped with either the professional or the ultimate with a little more power. So, okay, continue on.
Maria wants to know, when treating head injury only or simultaneous treatment of coordinated areas over the whole brain, what are the criteria are considered when proceeding? Well, if you had a CT scan or whoever had a traumatic brain injury and you have the report and they say, and this is 90% of the time, maybe more, you visit to the emergency room, do a CT scan, and no bleeding in the brain, there's nothing to see. And if they do a follow-up one, there's no focal lesion. There's no area focal, a spot area in the brain that's damaged. It's all over and it's generalized. So there's no problems if it's that kind of traumatic brain injury, and most of them are bilateral. Because when you have a traumatic brain injury, you have an event that's called coup contra coup. So your head, goes forward and then it goes backwards, or then it goes left and then it goes right. So there's damage everywhere. And it's not like a stroke where it's a focal area of infarction on the in one area on the left side of the brain. So this is the brain that I carry around here, and so it gets jostled, and it's the most amazing thing because we have cerebral spinal fluid all around the brain before it would hit the skull. But when it moves really fast, it hits the skull hard, the inside of the skull, and that causes a lot of the damage. And this is very funny because I went to hear a lecture once. This was really something. Why don't woodpeckers get brain damage? Okay, what's special about a woodpecker's brain anyway? Well, guess what? Woodpeckers don't have the cerebral spinal fluid that is, allowing the brain to float around and float forward, float backward, left and right. Always all solid. It's right against the inside of the skull. It's really jam-packed in there. So it can't free float back and forth and cause damage that way. And the same is true for the sheep, the butting heads sheep, they go with the horns and all
Rams,
those parts, and they butt heads. Oh no, their brains are right against the inside of the cranium. And so that's a good design. Yeah, if you're gonna do if you do that sort of thing, or banging your head, I can imagine.
I haven't taken on a tree lately, so that way, but one time
we wouldn't suggest it either.
Yeah, one time I came real close when I went skiing, but I'm glad I didn't meet up with the tree the way I did. But some do, and this is where light therapy is needed. So we got another question here. Go for it.
Oh, okay. Well, I can mention one thing about treating autoimmune. I don't treat the autoimmune disorder itself. And I did have a patient who came to me once who was losing her hair. She did have lupus. And I guess that's something you can get when you have lupus, is autoimmune disease, and even alopecia areata. So it was coming out in patches, 2-inch diameter patches all over her head. She was very upset. I could see why. And, but I just started in. It was a long time ago, maybe 1989 or something. The only laser I had was 780 nanometers, kind of between red and near infrared. And I treated, it's in my laser acupuncture textbook, the pictures and how I treated. And it's a funny thing when you're trying to grow hair. It takes 4 weeks to see anything, because the follicles with lupus, they're all inflamed against themselves, and the roots and the follicles are not doing well. They're highly inflamed. But when you put the red or near infrared laser or LED over the bald spot, you just have to go to the bald spot. That will decrease the inflammation. And you need to treat it Monday, Wednesday, Friday, or maybe a little more often, every week for 4 weeks. And then it starts to sprout up like weeds. It's really something to see. It just comes up, but it takes 4 weeks because there are these phases that the follicles have to go through to grow hair anyway. So you have to be patient with it. I'm not surprised there's so many helmets now on the market all over the internet. Grow your hair, this and that. I mean, I did it with someone who had alopecia areata, and she had lupus, and it stayed for 2 or 3 years, and then it started to fall out again. So she by then could buy a red LED whatever and keep the hair, and so it can be really helpful.
Yeah, just to help with some questions that'll come out of that one. We're talking a different type of technology, very low power for growing hair, because you only have to go in the first layers of skin. You don't have to penetrate the scalp and go through the skull and enter into the brain. The technology we have is for that. But as a matter of fact, one of the women had a lesion on her brain. She bought the helmet for that because she couldn't sleep at nights. Really very, very short sleeps, hour and a half, things like that. And she just totally broken up. And she got the helmet for that, and the fact that she was sluggish during the day, she had no energy, agitated, and she was able to use the light, and she improved dramatically, being able to, the first time she used the helmet, she slept for 7 hours in a row, which she was just blown away with. But the other thing, which was a side effect of using our helmet, was she was
I've heard that
wearing a wig, and now she was starting to grow hair, and she was so excited about that too. So, and I imagine that adds a whole lot of hope when you see improvement in those areas. So
those are really important things.
Yeah,
I'm just going to comment on the autoimmune disorders. Individuals with autoimmune disorders tend to be particularly sensitive to light. So I would definitely, I've treated conditions, but you would start off very slowly and gradually work up. So, and as far as contraindications, certainly one of the things, if we're talking about traumatic brain injury, and definitely treating C2 or in the back of the head, if you have migraine headaches with aura, then we would just be careful about not treating right around the brainstem, C1 to that area, because you can faint. So it's just to be mindful of that. Yeah.
Okay. For concussion, this is from Michelle. For concussion, do you only put it where the hit to the head was?
No, I mean, unless you have a report that shows that you have a spot that's a damaged area, maybe you had a stroke after the concussion or at the time of it, who knows? Then you would only treat where that was in the radiology report that, oh, there was a small stroke or there's a focal lesion, we might call it, it's an area of infarction. Then you would treat that mainly. But all our TBI cases, we treated both sides of the head, no problem, traumatic brain injury, both sides of the head, unless there's some other confounding report in the report from radiology. We have had no problems. So we would want to treat both sides of the head because, as I said, you know, the brain in the humans anyway is getting sloshed back and forth, forward, backward, and all that. And so you got brain damage all over, really, usually.
Okay, we got a question from Beth here. Thank you very much for answering these questions. My friend in Virginia is working with him for her dog. Great news, great news.
Oh, good.
Dr. Hirschberg, yeah, that's great.
Oh,
Alright.
with Dr. Hirschberg. Oh, great. Yeah, it must be in Boston area. Good.
Okay.
Okay. The
And
kidney-
we got, I will mention, we have quite a number of doctors online here tonight. Dr. Sheila Furry. Sheila, what are your recommendations for neuropathy, non-diabetic, and diabetic
Non-diabetic, yeah.
neuropathies? I'll let you two answer that. And we do have others that have looked into neuropathy and have been able to improve with PBM.
Can
What
be
have you
quite
learned,
effective.
Anita? And
I mean, I only know that a licensed acupuncturist here in the Boston area who uses a lot of lasers and LEDs gets very good results with
Mhm.
peripheral neuropathy. Depending where it is, you use red or near infrared, and the LEDs work.
Yeah,
I need
it
to
can
consult
be.
that because
Yeah,
I don't.
absolutely. That can be treated quite effectively. In fact, both for wound healing and pain, it's not uncommon if you've lost a sensation, let's say in the lower limb. Some individuals walk, they don't even feel their pants against the leg. When we start treating, because you're increasing the vasodilation, blood flow, and nutrients, as those nerves sort of come back to life, you can actually go through not feeling anything to pain, and then things start to
Yeah.
subside. But it can be treated very effectively. Again, quite often, you need to continue the treatment because when you stop, the pain will come back again, lack of blood flow. So this is really, although there's some angiogenesis, you know, blood vessels that will in fact sprout, most often you need to continue that treatment.
okay, I'll just take the next question here and then you can add into it. So John asks, how do you treat tinnitus? Where do you place the palm and what wavelength? So what we've been finding effective so far, and my numbers are growing, but I think I'm now 10 out of 13. So 3 people have not been helped, but 10 people have. So, and there's others that are reported back to me, but I don't have a close handle on it. So I'm just saying about those personally that have come forward to me. So we've been using the 1 minute of the red, the bright red, which is 660 nanometer, because it will have a high influence on the blood in the area, and blood absorbs the 660 very well, doesn't penetrate as deep. But once you're influencing the blood is going beyond the area that you're treating. So you have a systemic effect that's happening over the whole area, you know, over that whole area where you're treating. And that's ideal, even when it comes to stuff on the brain. If you can help the blood flow in that area, you're going to do great. The 810 or the 1050, the other wavelength. So 1 minute of the bright red and 3 minutes of the dim, or I say dim is deeper or invisible is deeper. So you use 3 minutes of that wavelength and we've seen success. Now, I don't know what the upper end is as to how long people can treat, but I know one person that we have recorded on the video of our website, they ended up treating 20 minutes and they just, they decided to do that on their own. And there's significant reduction of tinnitus that hung around for a very long time. So
Wow.
we've been always just going at the, like you talk about, starting off slower and lower in the amount, but I do have people treating several times, even 3 times a day. And we've seen tremendous recovery time in those different things. Now with the brain, I think again, it's something that people have to go through slowly and work their way up to maybe twice a day. But I do know one person that there was a problem if they took the light helmet on and they did it at 7 o'clock in the night, they'd never see their husband because they fell asleep long before before their husband got to bed. So she ended up realizing that she needed to go to bed, use the light at like before supper. And then she didn't have that problem. She could still see her husband and then knock off and have a good sleep. So timing sometimes has to be adjusted a little bit. When is the best time? If somebody's really wired, I know one person, they used the helmet and they needed to drive several hours home, and they would be one that would be fight trying to stay awake at night. And they said they just clear as a bell, went all the way home, not a stroke of tiredness in them whatsoever. And they, so I guess it all depends on the physiology of the brain for different people, right? So you have some additional thoughts on that? We've seen the tinnitus with helmets, with the palm. What about
That's
yourself?
great. I mean, it's such a difficult condition to treat. There's no doubt about it. So that's wonderful. And I guess if you start off low like that, it's just such a powerful unit. And so how often were these individuals treating then for the tinnitus in your experience?
Like twice a day, and even 3 times a day after they worked their way up to that. I said, don't start right off at that, but everybody has different ideas on
once
Yeah,
they
and,
have the device. Yeah.
The study I talked about from Japan, and even one of our football players who did so well, getting great reduction in his tinnitus, they weren't really treating the ear at all. Well, of course, the whole head was being treated, but the study from Japan talked about treating the stellate ganglion on the side of the neck, sort of below the bottom of the ear, down in here on that side and on each side, and they got excellent results. So you can probably treat the size of the neck as well, doing
That's a good
local one.
idea. Yeah.
Okay.
So what's left? Oh, this is Lyme disease. I don't have experience with that. And it might be
Lyme's disease is a
this-
tough one, definitely.
Yeah.
But one thing I
They
have
need antibiotics.
One thing I have heard that I've gotten a couple times feedback is that it does help with the symptoms, light therapy, usually like a lot of external symptoms. But as far as trying to get at the root, that's a tough one. I know that one person that I know in particular went somewhere. I think they went, I'm not sure, don't quote me, but I think they went to Mexico and they went through hyperthermia treatments, very high temperature treatments, and tremendous improvement after that. So, our
For
bodies
Lyme.
go into fever mode to knock off whatever is there. And that's basically what happens with this hyperthermia. Okay. How many more questions do we have here? Because we've been going, wow. Oh boy, oh boy.
We may have to continue some of this next week as well.
We need Tom for some of these answers. Yes. Okay. Well, let's see. Is there any reasons why SunPowerLED does a different way? Oh, yeah. Then Tom has to talk about that. Why do you do 1 minute? You said for the blood circulation, and then 3 minutes. But why
1 minute is basic? Yeah, blood circulation, and the 3 minutes is the fact that it's another mechanism that still comes into the mitochondria, and so the 810 can still work at the mitochondrial level. But it penetrates much deeper. So you really want both. You want to get some depth to get to the inner ear area. And vertigo is another thing I've seen improvements for. Where do you treat for Parkinson's? I see here by Andrew. Can you talk about that? Parkinson's.
There was
Uh,
Dupuytren's contracture right before that. Do you think it could help with
Oh.
Dupuytren's? And later Hosan. I don't know what that's about.
Okay.
But Dupuytren's, anybody comment? I don't have experience with that.
Okay, I do. One of the chiropractors said that this person had it's starting to pull in, the tendons start I'm not exactly sure, I can't remember, shrinking or something is going on that
contracting, yeah.
contracting.
Correct.
And so the one, it was funny, you can tell people some things and again, they won't listen. But I talked to this one chiropractor and I said, look, both wavelengths are very beneficial. Use both, you know, the 660 and 810. And so, but the 660, because it's so bright, it's very impressive. So he thought, what's that, you know, dim light go, you know, that's not going to do much. Well, what he told me is he called me called me afterwards to tell me, he says it was months later, his patient first got the treatment with the 660 nanometer and saw quite an improvement in his hand, but kind of just leveled off and he wasn't making any other improvement. And the chiropractor was rather disappointed that it wasn't going the full. And then he says, I wonder if I should try that 810. So he started combining the 660, 810. The person got 100% back on their one hand, and their other hand still needed more time when I talked to him. So, you know, there's a benefit to both of these wavelengths. And when it comes to 1050, you got a wavelength that there's even another mechanism that Dr. Michael Hamlin talks about. It's called, I know it's up for grabs as to the knowledge behind it, but I think someday we'll figure out what this other phase of water or structured water is all about. But Dr.
Right.
Michael
Yeah,
Hamlin
I
talks
think
about
that's
it.
pretty important. I think, Tom, I'm just going to comment on something because I understand from a visual perspective why you say this is dim light. But I think sometimes it gives the impression that it's not as powerful
Oh
as it
no,
really
it's the
is.
same. It's the
It's
same
well, it's
power.
not
Thank you.
only just the same power, it's got that depth of penetration.
Yes,
So it's invisible to the naked eye, but as powerful or more because you can get that light down to deeper target tissue.
exactly. Thank you.
So I just
Thank you
thought
for
I would
clarifying
suggest that.
All right.
Parkinson's, are we looking at that? We're just completing a study right now on Parkinson's.
Yeah, I
Yeah.
need to have to take that. That's very good.
So there are a number of areas that we would treat. We would treat transcranially. So if you can't afford the helmet, then certainly looking at the palm. And there would be a number of locations that we would treat on the head. But we're also treating the gut. And I think even in our neuro and our neurodegenerative conditions, I do believe that is something that we will start to do. I'm now incorporating it into my clinical practice. I treat transcranially. I often treat intranasally, and we can't underestimate how powerful that can be as well. But we're treating the gut, the microbiome. We're also increasing serotonin production. We're increasing dopamine production in the gut, and we're decreasing inflammation, which is so important. And if you look at the vagus nerve, that's connected, longest nerve in the body, from the gut going right up into the brain. Parkinson's now can either, we understand, start in the brain and affect the gut, and vice versa. Many individuals with Parkinson's have GI issues, constipation, bloating, difficulties. They may be, IBS or Crohn's makes them more susceptible to the possibility of Parkinson's. So we need to treat the gut as well as the brain. So that protocol would be important, and treating the back of the head would be very important as part of that protocol.
I'll just
Happy to share that.
I'll just say a couple, because I think we got to call it quits right away, because I have a flight to go out in the morning. And
Oh,
I still got to
wow.
get ready. But
Yeah.
there is a bunch of questions here. I'll just really, really quickly nail a couple. And then I'm sorry if your question was not answered. We will forward those questions to us. But if in any case, you should really see a doctor or a professional to get their advice on things. but then also, they probably know nothing about photobiomodulation. So, and a lot of times they're not willing to learn. So this is something you're going to have to make a choice in your own wellness direction, like what you need to do. And, but learn first what it is that they think it is, and then learn what has to be done, and check it all out. Learn as much as you
And
can.
there are people here to help. So, you know, once you get that device, I think that's important.
Yeah, we
I
do.
want to mention, there's a question, can someone has a pacemaker use this technology safely?
Yes, yeah.
Yes,
I've had
and
no,
not electrical at all, so
No.
it's not gonna interfere. That's important for
No
them.
magnetic energy, so it's fine.
yeah, yeah. So it won't, and I've seen thyroid dysfunction, whether it's hyper or hypo, where the thyroid starts coming to a more balanced place. But you do have to, again, see an endocrinologist to start getting that under control if there's a problem. But there's over time, we have seen some really neat effects on improving some of these conditions. And let's see.
Two questions on the nasal probe, the nasal adapter. Yes, I think the intranasal is very important because you can get the photons up to the olfactory bulbs at the base of the orbital frontal cortex, 1 synapse away from hippocampus. That's the only way we know how to get there.
Yeah.
But it's gotta be near.
Yeah, I'll grab one more and then we got call quits. Is just about using the my fiber optic probe. It would be possible to put the light that
Oh,
way.
yes, you
No,
could.
this is our probe that snaps onto the
Might
front.
not be too comfortable for 25 minutes, but
Well,
okay.
actually, because you got the light level that you do,
Oh,
it's like
okay.
you would be looking at about 2-3 minutes of time with this like that. Sorry, I won't go into detail. We won't. All right. I want to thank you both. This has been absolutely phenomenal. We've had our attendants hang right in here for listening to all these answers and learning. We want to learn with you. As you use the photobiomodulation devices, send us emails what you've learned, because as we put this out there, you know, more and more people are going to learn about it, and they're going to start utilizing this, and not only telling others that this really can be a help and a hope to many. So thank you so much for joining us. And next week, remember, we've got these two special guests on next week. They'll even have a better time because I won't be here. So anyways,
Not
thank
at
you,
all.
everyone, for joining us. Remember,
Thank
visit
you
our
for doing
website,
this.
SunPowerLED.com. Forward your questions to info@sunpowerled.com. And please go ahead and make your purchases on SunPowerLED.com. You won't be disappointed with using this light technology, and there'll be a pile of people around you you're going to be able to help as well once you have this in your hands. So thank you both for being on tonight.
It's great.
Take
Thank
care,
you.
Tom.
Okay.
Safe travels.
Yeah,
Thank
safe
you.
travels.
Yeah.
I'm in
Bye for now.
Texas. Okay,
Bye.
bye-bye.